Good afternoon and a warm welcome, everyone, to our great panel in the room and to the audience online. I'm Florian Tille. I'm with the European Observatory on Health Systems and Policies, and it's my pleasure to moderate today's webinar on breaking barriers, fostering collaboration to strengthen cancer research and care. We greet you from Warsaw, Poland today on a special occasion because this webinar today coincides with the launch of the Polish National Cancer Mission Hub that's being held during the first ever Cancer Mission Fair here in Warsaw this week. The focus of today's webinar will be on National Cancer Mission Hubs. But what are these hubs? So the EU Mission on Cancer seeks to reduce disparities in cancer care and research across Europe. And for this, National Cancer Mission Hubs are being established across the EU. Those hubs really are country-level structures to bridge European, national, and sub-national levels. Their main objective is to improve collaboration between policymakers, researchers, healthcare professionals, and all other key stakeholders in cancer. The ECOS project is developing the hubs, and we are very privileged to have the ECOS project coordinators with us today. Thank you very much for joining and for telling us more about the project. As keynote speaker, I'd like to invite Anabela Isidro, coordinator of the ECOS project and of the Portuguese National Cancer Mission Hub, from the Agency for Clinical Research and Biomedical Innovation in Portugal. Dear Anabela, it's really great to have you with us today, and I invite you to speak to us and give your keynote. Thank you very much.
Okay, thank you. So thank you very much, Florian. Good afternoon, everyone. So I'm here to representing ECOS project, as it was said. Can we have the next slide? So cancer is not only a health challenge, but also a political commitment here for the European Commission. The EU Mission on Cancer sets an ambitious goal and an urgent goal to improve the lives of more than 3 million people by 2030. So achieving this mission requires a coordinated cross-sectorial response that fosters collaboration among key stakeholders and enables the effective sharing of knowledge and best practices across Europe. It is within this context that the concept of establishing national cancer mission hubs in all EU member states and associated countries was born and was thought by the European Commission. So in the next slide, so as illustrated in this slide, national cancer mission hubs play a central role in the governance structure of the EU Mission on Cancer. They act as a vital bridge between the EU level and the national, regional, and local levels, ensuring a coherence and coordination across all layers of governance. National cancer mission hubs support the alignment of EU strategies and policies with national priorities, enabling a more effective implementation and greater impact on cancer prevention, care, and research across Europe. So, and to support this vision, the next slide, please. To support this vision, there was the need to find a framework, and ECOS project was launched in order to provide this framework and with a primary goal of promoting and facilitating the creation of national cancer mission hubs across Europe, driving national alignment and strengthening the collective impact of the cancer mission. In the next slide, I show you the partners of ECOS. So in order to promote the implementation of national cancer mission hubs in all member states and associated countries, the first step was to try to involve at least all member states in ECOS, and we achieved that. We have all member states plus 3 associated countries and more than 60 organizations from these countries, along with the European Cancer Organization. And it's a very diverse consortium and reflects a broad spectrum of expertise and perspectives, comprising ministries, research institutions, healthcare providers, patient organizations, and more. And we are all committed to the fight against cancer, of course, and to the EU Mission on Cancer. And so how did we plan to achieve? In the next slide, I show you the strategic objectives of ECOS. So the first objective was, of course, to promote the creation of national cancer mission hubs. We also need to, another one of our objectives is to create synergies and promote synergies among different initiatives in the cancer research, in the cancer ecosystem, European ecosystem, towards a cancer in all approach. We also want to have or to create or to work on impact models for stakeholders engagement, so to have a real impact. And we will create a network of national cancer mission hubs that will remain so that we can be sustainable and we can continue on promoting the implementation of the mission on cancer. And of course, as in the mission on cancer, citizens' engagement is at the center of our work. So how did we do it? For the first 2 years, the next slide, please. In the first 2 years, we were very focused on defining the national cancer mission hubs and developing their conceptual models, meaning what is the definition, the structure, what the activities should they do, etc. I'm not showing you today all the activities and all the document. The document will be available very soon at our website, but just want to give you an highlight of this. So you have the definition written in our slides, and I want to emphasize that in the beginning we realized that the approach one size fits all would not be appropriate because of the diversity of the countries and the healthcare systems and the way they work inside. And so in the end we had 4 different structures that are highlighted in the screen. We have a coordinated national action, the consortium, a legal organization, and the joint venture. All models are grounded in independent helix collaboration framework, which brings together 5 key sectors: governance, governments, academia, business, civil society, and healthcare, in a process of co-creation, co-design, and co-implementation. And this is actually the new thing, to co-create and co-design and co-implement. Importantly, each country retains the flexibility to adopt the model that best fits its national context, ensuring relevance, feasibility, and sustainable implementation. And in the next slide, we show you some of the core principles of these national cancer mission hubs that should integrate in our collective fight against cancer. So the values are the foundation of everything, and here we decided that the values that were best fitting for us was trust, knowledge, diversity, and leadership. These values will guide the actions and decisions, ensuring commitment to the cause. Our objectives are clear and ambitious. National Cancer Mission hubs aim to position the fight against cancer as a national priority in all policies, to promote capacity building and synergies, to nurture a collective awareness and social culture against cancer, and to stimulate investment in cancer research and care. To achieve these objectives, National Cancer Mission hubs will work to guarantee the implementation of EU Mission on Cancer and also the European Beating Cancer Plan, coordinate multi-stakeholder initiatives, create societal awareness, facilitate collaboration between stakeholders, and support health in all policies. And finally, the attitudes within the National Cancer Mission hubs will reflect the interaction with others, respectful, motivators, inspirational, and diplomats. These attitudes will help building strong relationships and drive positive change. And so these are the core principles and activities, but of course, more details, you can then consult our documentation. Please, in the next slide. So after defining the National Cancer Mission hubs and developing the concept models, we successfully designed a recognition system to categorize National Cancer Mission hubs into 3 stages: the starting stage, the consolidator stage, and the advanced stage. And I have the pleasure to tell you that we have recently granted the starting stage status to 5 National Cancer Mission hubs, that are in which flags are in the slide. So Poland, Greece, Malta, the Netherlands, and Bulgaria. The official launch of the first National Cancer Mission, as was told in the beginning, is the Polish one, which will take place, of course, during the Polish presidency of the European Council. So, and besides building the models, in the next slide, we also show you, we are also supporting the implementation of National Cancer Mission hubs through different activities. In here, I show you the impact models for stakeholders engagement, and we hope that with the robust methodology for designing activities that are both meaningful and impactful. To support this, ECOS is developing a comprehensive framework to impact assessment and evaluation, enabling hubs not only to assess the effectiveness of past initiatives, but also to strategically plan future actions. So, complementing this, a portfolio analysis framework is also being developed to guide National Cancer Mission hubs in identifying where to allocate time, people, and resources to maximize impact and prioritize areas of activity. So we are also, this information is also at our website if you want to explore the document that is present in the slide. But another activities in the next slide to support the implementation are these knowledge exchange events. And this will facilitate, as the name indicates, the exchange among its members. So we have realized already several knowledge exchange, 5 so far. We involved 27 participants from 15 different countries, and here we exchange best practices and way of working, and how in each country we are trying to develop these National Cancer Mission hubs, or for those countries that already had the national hub-like structures, also helped in thinking of how to start. And we will also continue this probably in the future with the idea is also to have specific activities that may be of interest for several countries. So, and also as part of this effort to strengthen the capacities, in the next slide, ECOS is also partnering with the European Observatory on Health Systems and Policies to organize the policy dialogues. So that's also why we are here today. A structured methodology designed to facilitate multi-sectorial and multi-stakeholder discussions. And they are also building the tools that allow countries to do it on their own, and will soon be available to all. These dialogues aim to support informed decision-making by policymakers in key areas of cancer research and care, and we have been doing this in several countries of Europe. So in the next slide, I think we are also doing, well, another, as I told you in the beginning, citizens engagement is also very important. And so in here, we are both trying to see or to have the landscape, we perform a landscape analysis of the reality in each country. We have published that, and we are also have a toolbox for stakeholders engagement that is also present there, also available at our website. And for the hub-like structures, we have the country-specific reports that gives a highlight of what is the reality in each country that belongs to ECOS, and already gives a vision of how we are and what countries are more advanced or less advanced. And so basically, this is what I wanted to tell you today. We have still lots of work ahead in the National Cancer Mission Hubs implementation and the support to the EU Mission on Cancer. But I think this is already a nice start. Thank you.
Wonderful. Thank you so much, Anabela, for sharing some of the key experiences and findings from ECOS after 2 years in. I'm sure we'll be able to address some of those issues even more during the Q&A following the keynote and the spotlight presentations. And as a reminder to everyone online, please, for those who join us for the first time, you do have the chance, and we very much welcome your questions, reflections. In the chat online, my dear colleague Erica is monitoring those, and I've seen that some are already in there, some very good questions. So if you do have more to ask, please do share them online, and then we'll receive them and we'll be able to address them in the second half of this webinar. Okay, moving on. After having learned now quite a bit about the mission, ECOS, and how the national hubs fit in, we'll now have the pleasure to hear a bit more about some concrete country experiences on how these hubs have actually been established until now. Can I please invite Ian Gauci Borda, who is a senior executive at Xjenza, Malta, to share some of his findings and his experiences on the process in Malta. Ian, could you please come in?
Yes, hi. Thank you, Florian, and hello, everyone. So my name is Ian Gauci Borda, and I come from Xjenza, Malta. I also work with the Cancer Research Innovation Hub Malta, which is a newly set up foundation, which currently hosts the National Cancer Mission Hub. And I'm very happy to share with you our experience with regard to the setting up of the National Cancer Mission Hub in Malta. As you saw in Anabela's slide, Malta is one of the first 5 countries to have a National Cancer Mission Hub. Coming from a small country, maybe this could be the right place to say small is beautiful, because when you are a small country, maybe it's a little bit easier to coordinate with the very different actors that you have at the national level to come up with a hub which works, which does what it's supposed to be doing. So last year we set up a foundation whereby we try to bring all the actors together, and there were several ones. So you have the healthcare professionals, you have the researchers, you have the academia, you have the industry. So when you talk about cancer at the national level, in order to bring everyone together, it could be quite challenging. And we did this through the foundation, that we built it around the governance of a pentahelix. So the pentahelix is made up of the academia, the industry, the government, so the policy side, the associations, so have also the group of associations in there, and also the healthcare professionals. And we set up the foundation with the aim of turning it into a hub. I think the most challenging part of the setting up was convincing the politicians to help us to set it up. So part of our mission was to convince them and to kind of invest in the National Cancer Mission Hub, and to show why it's relevant to have. It was relevant because we could see that there was a lot of fragmentation, and when it comes to cancer research, and also being a small economy, it can be very dangerous to have a lot of fragmentation in your system. So in order to optimize our policy mix for cancer research, which is also one of our priorities when it comes to the risk strategy, so it's one of the risk strategy priorities. The argument was made that, look, you have the healthcare professionals which are doing their job, you have the researchers who are doing their job in another direction, then you have the industry, and it all seemed too fragmented to even implement even the policies from the governmental level. So we went to the government, we convinced them. We convinced them also with a little bit of a political argument that, look, cancer is affecting each family on the island. If you look around you, every family is currently undergoing some form of challenge with cancer. So why not have something which directly impacts the citizens? And that was, I think, in my view, the winning card with our politicians, because immediately in year 1, we were given a very good budget, a very generous budget of 1.2 million, which allowed us to also run calls, apart from setting up the hub, to run calls nationally, and to bring all the stakeholders together. At the same time, last year, we also had 2 inception dialogues, which were organized by the observatory themselves. So from here, I thank them for that. The first one we organized in July, which was aimed at bringing the officials together, the high-level officials together. So the Ministry for Health, the Ministry for Research, the funding agency. So it was more on the policy side of things. And then in November, we had the second inception dialogue, and this brought together the associations and the stakeholders and the industry. And they kind of both built on each other. And now recently we prepared for the launch of the National Cancer Mission Hub. The good news is that our budget has also been reconfirmed for this year, and we were also given an additional budget of so now we're around 1.8 million for 2025. And looking to the future, we have now won 2 EU projects, which we're very proud of, and we will become the national data node also for Malta. So you can see that from a concept, there is room for it to grow. So we will be working now to become the national data node for Malta, and also the projects will help us also, in addition to the budget that the government gave us, to also expand our activities as a hub. I think my 5 minutes are up, but I try to summarize all the activities that we have been undertaking, and I would be happy to answer any questions from the audience or from you, Florian, but I give the floor back to you. So thank you very much.
Excellent. Thank you so much, Ian, for sharing those experiences from Malta and the lessons until here. And I think some of the messages that you just shared, including on how every family on the island is supposed to benefit from the work that you're doing, really have come across very clearly. So thank you very much for this. As a second country experience, I'm excited to now invite Hugo Soares to please share the experiences on how the inception and the evolution of the National Cancer Hub in Portugal has come about lately. Hugo is co-coordinator of ECOS and of the Portuguese National Cancer Hub. And Hugo, please.
Thank you, Florian. Our experience starts not so differently from what Ian just described. So at the beginning, in 2021, we foreseen with the starting of Cancer Mission and the approval of AICIB and all this coming together at European level, that an organized community on cancer would be needed in order to be able to uptake more efficiently all the opportunities that would emerge from these 2 important strategic documents from the European Commission, the AICIB and the Cancer Mission. So we approached also our authorities in order to create what we called at that time a working group on cancer to implement European initiatives. This working group is coordinated by 2 agencies, one the Agency for Clinical Research and Biomedical Innovation, and the other the Director General for Health. And with this, we bring together what is the healthcare sector from the Director General for Health and the research sector with AICIB here playing the role as the facilitator with the healthcare and academia, the research and academia community. And this was the kickoff, this was the seed, this was the starting, the embryo, because with this, then we start multiplying. And I think this is one of the key points or the key messages that I want to leave here today for those at home, is that a National Cancer Mission Hub should always look at the multiplying effect, the amplification effect, whatever. By working with key people, those that are the conveners, those that have a word, those that know how to play in different sectors, we can get easier to this type of community. So these are, if you want, the influencers or the leaders in a certain aspect. We as agency, we have, of course, our network, but we still need to work our other networks across sectors. So we need to work, saying, the pentahelix of the industry, the healthcare, the research and academia, but also the social, the civil society, the education, you name it. We are all responsible for cancer, from prevention to quality of life. This means education and also means social security. So, and this started with mobilizing people that were motivated. We invited everyone to join, and we did not cherry-pick this specific people, but we opened an open call for those that were motivated to have help. And this helped developing a community of motivated people willing to work, the coalition of the willing, if you want to say, which then, even if they are not the most well-known person in the area, they are those that are able to work around the area and get people together and mobilize them for the action. And it grew from there. Now we also have projects that we are funding. So we not just ask to do things on voluntary basis and to work given sectors or activities, but we also provide financial support to these activities, and we help developing this consortium. So if there is an idea for a project, and someone says, we have this expertise, we have this network, but something is still missing, we help working around the community to identify where the missing pieces are, and with this, again, developing more robust project teams and so on. So this is how it started. I believe key messages are not just the multiplication effect, but also, if I can say, there is no right time to do it. The time is now. Because once you start, things get going. And if you wait for the right moment, especially in cancer where everything changes on a daily basis almost, you hardly will find the right moment. There is always something happening. So I would say start and get people around you that are able to deliver, that are motivated and flexible, of course, because as things change, we also need some flexibility.
Okay. Thank you, Hugo. Thank you very much for sharing the experiences from Portugal and where you are with the hub and what you've learned. And I think really this aspect about the multiplication or the multiplying aspect that the hub really has come across very clearly. So now reflecting on these experiences a bit with the hubs and working across levels and what the hubs were able to achieve, I'm now inviting Kay, Doug, and Waltz to share some thoughts on the future of the EU mission on cancer and on the National Cancer Mission hubs. Kay is Policy Officer at the Cancer Mission Secretariat of DG Research and Innovation at the European Commission. And Kay, I'll pass the floor over to you, please.
Thank you. Yes, I'm a Policy Officer at the Cancer Mission Secretariat with responsibility on the policy side to support the ECHOS project. And for next slide, please. And I think, we're at the very start of these mission hubs, and the EU Cancer Mission has inspired many member states to change their governance approaches to cancer control. And a number of countries like Belgium and Spain have mirror groups. And then, of course, we have all of what we've seen from Portugal and Malta, the work that's ongoing there, and the other future hubs such as Greece and others. And there's also in Sweden, there's the Vision Zero Cancer organization as well, which is mirroring what's happening in the EU governance structures. So in Belgium, they brought together a diverse coalition of stakeholders, and same with Malta, and I understand Malta has a champion to bring all of this together. And then their policy dialogues identified the key stakeholders, and in Belgium they also identified funding sources for these projects. How can the governments continue to support and resource the National Cancer Mission Hubs? So I think the first thing would be to give a formal governmental endorsement, that you're on the side of these people who are bringing all of these stakeholders together, and to identify a very broad range of stakeholders, include everyone in these hubs as well, when you're bringing the hub together, and to build on existing national or regional initiatives that are there for cancer. And then also to combine the resources from different EU and national projects and national initiatives and EU initiatives. And to identify priority areas that many of the mirror groups and the hubs have done in bringing their thoughts together and bringing their stakeholders together. So they've identified areas by consulting with the stakeholders and the citizens. And then an important one is to map out EU funding opportunities in cancer, and including private funding, because it'll be very important to get private funders and to be on board. And as you know, in the 2025 work programme, there is a call to continue the work of the National Cancer Mission Hubs, and then also to leverage European cancer initiatives from many different sources. And one message would be to use the resources that are available through the EU projects, such as the handbooks and the guidance and the tools for policy dialogues that the ECHOS project and the European Observatory have brought together, and also tools from the joint actions which are working in the patient area. So there's my some guidance as to what the governments can do to support the National Cancer Mission Hubs. So thank you.
Thank you very much, Kay, for the spotlight and for outlining some of the perspectives. Just as a quick note, as they're literally building up the event this afternoon, so the launch of the Polish Hub behind us, and there is a little bit of background noise, so if that's a bit disturbing, we apologize, but we try to keep it to a minimum, and we hope you can still hear us okay. And sorry if it's a bit distracted. Before we open the floor for questions from the online audience to our panel, I would like to use this opportunity also and flag once more that we've developed a set of publications and other outputs coming out of this project and coming out of our collaboration between the Observatory and ECHOS and DG Research. I believe Erica has kindly shared them online already. Please do check them out. Do look through them. It's a really, really good tool set. As Kay already said, there's a EuroHealth special issue with available as well. So we very much welcome you to have a read and really dive into these. Now, we think it's the right moment to open the floor to questions. So could I please move over to Erica and ask her what we've been seeing in the chat?
Thank you very much. Yes, it's been a busy chat. Greetings to everyone who sent their greetings from around the world. But yes, a couple of kind of more logistical questions have come through. One of them is about actually gaining government support for these cancer mission hubs. So how do we ensure that governments are fully engaged and giving enough support? And what more needs to be done to advance research in your countries? And another question about how hubs are working with national cancer centres. So how are you getting them to work, stakeholders to work together, rather than, as Ian was saying, sort of fragmenting the system? And then one question, I think this is probably more for Isabella, was, can you tell us a bit more about your approach to citizens' engagement? How do we achieve that? Because that can be one of the most challenging things in these projects. So I'm going back into the chat box now, but yes, please keep your questions coming in for round 2. Thank you.
No. Anabela?
Shall I start?
Yes, please.
Well, so as for the citizens' engagement, yes, this is definitely the most challenging issue, because well, citizens don't want to care about the disease itself, so we have to engage them in a way that it's not a heavy way, but a more attractive way. At the moment, we are working on what each country has done to engage citizens, and we are trying to build this landscape analysis and all these tools so that we can also then have a better approach to citizens' engagement. We are also here in Poland. Tomorrow we will have we have a fair dedicated to citizens' engagement where we will show different practices on citizens' engagement, and we hope also to learn a little bit with each other and with this showcase. So yes, we are still building the best way to attract citizens, and probably we have to also again tailor it to each country, because each country probably has some particularities in this aspect.
Thank you very much. Anabela? One of you would like to respond to the government, and otherwise I think it's for you.
Yeah, I can comment on citizens, just complementing what Anabela was saying. So as we are running this landscape analysis, knowing what people are doing, we are also investing in what we call the knowledge exchange program. So not just knowing what each one of us is doing, but also sharing our experience so we can better implement or replicate what can be replicated. And now for the next phase of the project, we will be looking at all these different initiatives from a scalability point of view, because some of the initiatives are really nice. I can say some are amazing, but moving that initiative from one ecosystem to the other is challenging for many reasons, from resources to context, proximity, and so on. So we, as Anabela was saying, analyze, share, and now the next stage will be the scalability of all these different initiatives.
Thank you very much, Hugo. On the question on government support, is this one to address to Ian maybe?
Yes, thank you, Florian, and yes. So basically, support is never enough. So when it comes to cancer research, as I said before, there are so many players at the national level, everyone doing his own thing. That really and truly, when it comes to funding, it's never enough, and it's never enough because and this stresses the importance that I said before, that we felt this urge to have this kind of optimization of the policy mix to make sure that our investments are all being channeled in one direction. With the budget that we got in the first year, we opened up a call and it was heavily oversubscribed. So this explains the reason why the budget has been increased in 2025. Going forward, I hope that we will continue to be receiving these increases because we have aspirations. So something else that I did not mention in my initial presentation was that we have aspirations also to start running clinical trials in Malta. So Malta is a very attractive place to have a clinical trial. Why? Because it's a very small country. We have one hospital, and the chances of getting samples from an entire population can only happen in small countries. So going forward, we are looking at also having this center for clinical trials, and it won't happen with a snap of a finger, but this is why the hub is there, because we have aspirations and we hope that it will take us there one day. With regard to working with national cancer centers, as I told you before, we brought in the stakeholders. So part of the stakeholders of the hub are the national cancer centers themselves, and they also have a say in the work program, the annual work program that the hub is preparing for the cause. So they are kind of integral part of our system. When it comes to the cancer mission calls, then we disseminate all the information that we get directly to the stakeholders, and given the fact that the National Cancer Centers are part of our stakeholders, they receive this information firsthand. I don't know whether I have answered the questions, but I try to be as comprehensive as possible.
Yeah, thank you very much, Ian. Yeah, you certainly did. Thank you for sharing. I think we have time for a second round of questions, and for this, I move back to Erica for a little bit.
Hello there. Yes, just a few more questions from the chat box. Okay, so I think we need sort of, some of these are quite broad. So what were the main challenges in getting all these different stakeholders to work together, given that everybody has different priorities in what they're trying to achieve? And although the focus is very much on developing these national cancer mission hubs, is the aim for them longer term, is the aim for them to work together for more sort of transnational activities? And then one big sort of final question, I suppose, if you could all give us your top tips. So what are the best practices for setting these hubs up and for making them work effectively? Okay, thank you very much. Thank you.
Thank you very much, Erica. Ian, I see you unmuted yourself, so would you like to respond, please?
In fact, I can reply directly immediately. So Erica, you are right. So the initial idea is always, you have this fragmentation and everyone has his priorities, and then how to bring the priorities of everyone with one common goal, around one common set goal. And it was a challenge, I must admit, because you also have personas. So you have to deal a little bit with personas. You have people who think that they are the authority, and et cetera, et cetera. But I can say that as I mentioned before, we organized very successfully the pre-inception dialogues with OBS, and I see Florian was with us over there. So we really made sure to bring the top people from the institutions we wanted to target. So it was like a top-down approach in the different institutions we wanted to target. And it worked for us, because when you have directions coming directly from the top, it's normally easier than it is from the bottom up. So I think the strategy for us was good, that we brought them to this inception dialogue. They had chance to brainstorm and to give their ideas, to give like what they can give and what they cannot give. So the whole day was dedicated to really how we can work together without disturbing much the wider public sector. So, and I think that was key to bringing everyone together and on the same kind of path towards the setting up of a hub.
Super. Thank you very much, Ian, for these insights. Hey, I think you would like to respond to that also.
Well, it was to the other question, I think, about whether the networks would be set up, because in the next round of funding that's available, one of the envisaged things to support the hubs is to put a network of mission hubs together and to expand the geographical reach of the hubs. So yeah, it would be a putting of the networking all of the mission hubs, certainly.
Thank you, Pam. Anabela.
Yes, I think I completely agree with Ian. I think we experienced the same challenges, and but the first challenge to bring all together, I think it's more or less easy, let's say, because people are still engaged and it's something new. They want to see, they want to contribute, and this, I think, it's more or less easy. I think the challenge will be to keep them involved. And for this, you have to, and we do it at the National Cancer Hub, you have to have activities and to be always engaging with them, and you for sure have to have people dedicated in this, not just someone having a bit of the time, but having someone dedicated also to engage and to think of interesting activities and discussions that you can always have, because there are many things happening in cancer, but it's okay.
Thank you, Anabela.
I don't get me wrong, but I find it quite easy to get people together because from my experience, the cancer community is really engaged in moving forward with new solutions for whatever problem we are talking about. It's easy to get them together, as Anabela was saying. And honestly, also, I don't see complication in the priorities of the different sectors, as long as there is a clear goal to achieve. And that sometimes is the hard part, because there are multiple ways to get to the same result. So what is needed is that we have a clear, let's say, leadership of someone that is motivated and dedicated to it, not just someone because of the degree. And that was the finding. I think the take-home message from our experience in Portugal is that the groups, we have created different groups, different working groups, all of them multidisciplinary, intersectorial. We have architectures working with clinicians and researchers and industry, and someone from education, startups, different, of course, dominated by researchers and clinicians, but we also have this more unconventional participants. And surprisingly, the groups that created a better output were those where diversity was higher and where the leadership was not the well-known professor, but someone that was easygoing and was able to put people around the table, discuss openly and define, so we are doing this and we are doing that, and this is how to move forward. So I would say that, is it difficult? Yes, it's not piece of cake, because otherwise everyone would be doing it. But sometimes we need to look a little bit outside the conventional way of working. And I remember listening at the early days when the groups were formed. How will we work with such a diverse group? We need clinicians here, oncologists, or whatever. And later on, the feedback was exactly the opposite, saying we were scared, we didn't know each other. We had groups of people, and Portugal is not a very big country, where people did not know each other. We are talking about 10 to 12 individuals, and they were all unknown between them. And after that scary moment at the beginning, diversity and knowing, things really thrive because there was a common objective. They were all there for the same, say, implementing a screening program or developing, I don't know, literacy information sessions, whatever. And because the facilitators, so you can call it coordinators, you can call it facilitators, you can call it whatever, but the person that was basically leading the group could be the coordinator or someone else that would just be the natural leader in the group, was able to convene this all together and make it forward. So it's also a way of thinking a little bit outside the conventional. And I think look at what you have, experiment, dare to fail. It's important that we dare to fail. We are not afraid of failing. And if we do, then we analyze and repeat or do differently to learn with that.
Thank you very much, Hugo, for this, and also for pointing out what might be or what have been the challenges and limitations of the hubs. On that point, on the limitations, I mean, we've been talking about hubs now for quite a while, and really have been very much also steering to some extent some of the development of them. I think a question that might come up also with someone who hears about it for the first time, well, what really is the scope, but really what also can be the limitation of a hub when it comes to how does it fit into an existing cancer ecostructure in the country, right? So we know that a hub can have both a rather active role, meaning it can fund projects or activities, or it can help with distributing funding, as we've also seen in Malta, as we're seeing in Portugal. It can also have a bit of a passive role, meaning that it has an advisory role, a consultative role. Well, what would you say? What can a hub be, but also what can it not be? So how should it not be, or how could it potentially be a bit overloaded, or maybe have raised too high of expectations? What's your experience on that, maybe from the past 2 years?
Thank you, very interesting, and thank you very much for putting that question. So one thing that needs to be clear is the hub is a structure of governance to implement cancer mission in the different countries. So we should look at what is cancer mission and what are we trying to implement. Cancer mission, if you go to the implementation plan, sets up 13 different recommendations, all bold actions to improve everything, reduce inequalities, and so on. But a lot of what is the expertise to do most of these recommendations, they already exist. So you have expertise, you have the technology on high-performing sequencing, genetics sequencing, and in academia and research labs. You have high-quality care in comprehensive cancer centers. You have, I don't know, you name it. Sometimes what you need is someone that brings people together, the convener of all these different experts, because we are still working in silos in many of the regions. And this is true. We have been contacting, we have 30 different countries in our consortium. We have been contacting with different realities. Most of them complain that we are siloed here and there. Ministries here, researchers there. So sometimes what is needed is for someone which has this task of bringing them together, facilitating the discussion, putting the output of the discussion, the recommendations, or whatever, or putting the money if that's the case, or creating this that we all want, but we don't have time to do it. It's often that we listen to, I don't know, different stakeholders, commissions, industry, researchers saying, we should have this, and that. And even though it's not so difficult to have this forum or this structure or this project or so on, it doesn't fall immediately in the responsibility of that organization or of that initiative or so on. So the hub should be the ones looking in what is missing and how can I help to implement it. Yesterday, I was talking with one of our partners saying, so what should we do? Apologize. And I said, look, you should analyze whatever you have in your country, the context, and you tell me what do you need. Because different hubs should and will work in different priorities. So there are 13 recommendations. All of them are valid, all of them are bold, and all of them are restricted in time. We cannot implement all of them at the same time. But we are also not all at the same level. If you compare the different countries, there are different needs. I can give you the HPV vaccination, for instance, where in Portugal we have a rate of vaccination above 98% for girls, 90 something for boys, I believe 92, 93. In other countries, like if I'm not mistaken, Romania, the rate of vaccination is below 20. So of course we will have different priorities. Still, to implement HPV vaccination programs in Romania or reference networks in Portugal, we all need the same. We need to put the people that have the knowledge, the expertise, access to equipment, resources together to discuss and make a plan and proceed from there. And we all have this, but we not necessarily have them communicating with each other and aligned in terms of timings and so on and so on. That will be the role of the National Transformation Hub, to look at the national context, bridge it, of course, with European context and initiatives and priorities, and see where can I take the best out of the opportunities that are emerging now in the European Commission to advance the national cancer care, cancer research, cancer policies. How can I learn with the others and do it? Basically,
It's that easy, isn't it? It's easy. Okay, very well, very well. Thank you very much, Hugo. I think this was like another very good clarification on what we understand as a hub, or what could be a hub, and then also how it might be implemented in the country. See, we have about 3 minutes left, maybe not even so. If Erica, if there's no objection to it, I think I could then use my role as the moderator to wrap up, and then also thank the group. But first of all, just very quickly, so we have heard how the EU Mission on Cancer is an initiative aimed at transforming cancer prevention, research, and treatment in Europe. In this context, we saw how the hubs are designed to fill some of the very clear gaps that we are seeing in cancer research and care, and how they aim to bring together stakeholders and strengthen the collaboration, as Hugo just said, European, national, subnational, local levels. Experiences from Malta and Portugal have shown how the hubs were established, and importantly, how they're functioning now, what some key challenges are, how they were tackled, and what the prospects are also going forward. Kay highlighted also very nicely the future of the mission and how the hubs align with it. Just importantly, really as a take-home message, going forward, the hubs won't just be established within the individual member states, but of course, a network of national hubs is being created, and this really is critical to support the implementation of EU and national cancer policies and strategies. So the ultimate goal really is to remind everyone to ensure that all European citizens benefit from better cancer research and care, and not just have something virtual as a hub, of course. So I thank everyone very much. People in the room, people online, Erica, Ian, thank you very much for making this webinar as I think a good success. Special thanks also to the organizers of the Cancer Mission Fair here in Warsaw for making this possible and for allowing us to have the webinar. We're very excited to be part of the launch of the Polish National Cancer Mission Hub later this afternoon. And to the people online, to our dear audience, we hope to welcome you next week, same day, same time, so Tuesday at midday, for the second part of our webinar series on cancer, when we'll speak about improving access to innovative cancer therapies. We've touched upon it just very slightly. Ian mentioned something on clinical trials, so we'll really dive deeply into this next week. And over to you, Erica, for some final remarks and concluding words.
That's all. Thank you very much to you. Thanks to everyone in Warsaw. Thanks to Ian in Brussels. And thank you very much to Lucy, who makes all this happen behind the scenes, based here in London. So thanks, everyone. And I look forward to seeing you all next week. Thank you very much. Bye-bye.